Good morning, everyone. We are Group 2 and welcome to our presentation. My name is Natasha. I will be giving you guys an introduction to the team and informing you of our presentation. So let's introduce the rest of the wonderful team. Everyone give a big smiley face to Alicia, who is our narrator. Now can everyone give a big thumbs up to our actors, Joe, who is our patient, and Jess, who is our nurse. Can you give a hands up with your little mouse pads if you have an idea of what caring communication is? Great. Now can you keep those hands up if you believe all patients should be shown caring communication? Awesome. So you have your standard communication skills, yet patients want and need more than this. They need communication that is warm, kind, and genuine. This is where caring communication comes in. This type of communication not only allows for trust and safety between patient and nurse, but also for a faster recovery outcome. Touch is a powerful communication technique seen as an art within the nursing practice. It is a simple non-verbal skill for nurses to portray their empathy and intentions towards the patient that helps to relieve stress and anxiety. Although it is a powerful technique, nurses need to be aware of the code of practices and standards to ensure boundaries are not crossed. Comforting and supporting is a difficult skill to use in terms of consoling a patient in their time of need. It is about actively listening to a patient about their anxieties and worries to show them they are not alone so they can face their issue head on. This presentation will demonstrate the correct practices needed to provide these skills by referring to the nursing code of conduct and standards of practice. By referring to these practices, we can help teach student nurses to identify when to use appropriate skills and when they have been taken too far. To make a better understanding of these skills, especially touch, comforting, and supporting, we will be using a scenario based in a hospital setting. So, the scenario, we have 86-year-old Esme, who has recently fractured her hip. Esme has just been told by her doctor with her current situation she will need to move into a nursing home to ensure her safety, which is a bit sad. This is a lot of new information to sink in, which has left Esme in tears. With the help of Nurse Jessica and you guys, we will demonstrate the best approaches to console Esme. We will be needing your help throughout the presentation, so keep your mouse pads at the ready. Okay, is everyone ready? Let's get into it so we can help Esme in the best way possible.
Esme has just received news that her whole life is about to be turned upside down. She is most likely feeling a mix of emotions, things such as despair, anger and frustration, fear, and most of all, lack of control over her own life. The first thing Nurse Jess does is wash her hands in accordance with the guidelines. Wetting her hands with running water, preferably warm, applying soap, rub your hands together for at least 20 seconds, making sure you cover all surfaces of your hands in between your fingers, no jewellery. Rinse your hands, making sure you remove all the soap and pat your hands dry with paper towel.
Was this a time-wasting step that stopped Nurse Jessica from getting to Esme quicker? Correct. It is not a time-wasting step for Nurse Jess. It is important that nurses are washing hands before, during, and after dealing with each patient in accordance to the guidelines. This prevents infectious diseases spreading and also shows the patients that you respect them and therefore doing everything you can to prevent their condition to worsen.
Good morning, Mrs. Jones. My name is Jess and I'm going to be your nurse for today, okay? So our plan for today is just to go through everything with you. So I know the doctor's coming this morning and just let you know about your living arrangements, okay? So I want you to know just to calm down a little bit, alright? Because we're going to work through this one together. You're definitely not on your own, alright? Just want to take some big deep breaths and let's just try to calm down, okay? Because we're going to be in together and you're going to talk to me and we're going to work it all out together, okay? Are you okay if I call you Esme? Okay, perfect. Alright, Esme, Let's just try to take some big deep breaths first, okay? And then we can sit down and have a chat about what's going on and work out the best plan for you. Yep, sounds good. And you're not in any pain at the moment? No? Okay, perfect.
Nurse Jess acknowledges her patient Esme verbally by introducing herself and asking the patient's permission to call her by her name. It shows respect as the patient is an older person. Nurse Jess can see that Esme is visibly distressed and knows she needs to try and work with Esme to support her emotional needs, gain her trust, and work with her to find a way to support both her physical and medical needs while ensuring her emotional state is also supported.
Alright, Esme, tell me how you're feeling.
Just want to go home.
Yeah, and I understand it's a really difficult time, isn't it?
So much things.
I know. And that's going to be okay because I'm going to be here. We're going to help you get through it as best ways possible for you, okay?
Esme can feel that her nurse is caring and kind and wants to help her. She can tell by her body language and her kind smile that she is there for her in this moment. Nurse Jess brings a chair closer to Esme to bring herself down to her patient's eye level. This is so she's not standing over her in any intimidating way, and by getting down to her level, it shows that she really cares and that she's giving her patient her full attention.
Let it all out, Esme, okay? It's okay to be sad about these things, alright? We're going to be okay though, I promise you.
Thank you. Thank you.
Raise your mousepad hand if you believe holding the patient's hand is a sign of support. Yes, it is, but it is also a sign of support and comfort delivered in the way of touch. By Nurse Jess holding Esme's hand, it calms and comforts Esme. It makes Esme feel supported and feel as if they are going to get through it together. It is also a form of touch which allows the patient and nurse to connect to each other.
I'm so sorry to hear about your bad news this morning, Esme. I can't imagine the feelings and emotions you must be feeling. So heartbreaking for you. But what I am going to do, okay, we're going to help you recover. We're going to be here to listen to you. I'm going to support you. I'm going to make you comfortable in any way possible. Alright, and you're not going to be alone in this. We're going to be doing it together, okay? Never alone. I'm always here to help.
It's my life.
As we see throughout this clip, Nurse Jess is listening and taking the time to hear her patient Esme. Raise your mousepad hand if you believe this is a good way to show support and comfort. It most definitely is. By listening to your patient, it builds trust, confidence in the practice, and respect, which makes the patient feel more comfortable and supported during such a difficult time.
Oh, it'd be so difficult to be told this, and my heart breaks for you. But this is the best outcome for you and your safety, and that's what's most important, okay? Why don't we calm down a bit, have a cup of tea, and let's have a little chat about everything, and let's make this experience the best outcome we can for you, alright? Alright, I'm back. I've got a nice warm blanket I'll pop over you now. Make sure you're all comfy, all tucked in. Alright. Is that one good? Perfect. And I've also grabbed you a cup of tea so you can be all nice and toasty and warm in your blanket. And we can calm down together and we can discuss it, alright? Here you go. Be very careful. It's very hot. Alright, okay? Alright, let's talk about this together, alright? We're going to be okay.
Raise your mousepad hand if giving a cup of tea and a blanket is a way of showing support and giving Esme comfort. Yes, it is. By Nurse Jess, giving Esme a cup of tea and blanket helps calm her down and comfort her. It also shows support to her patient by making her comfortable and supporting her needs. Do you think Nurse Jessica used effective and appropriate techniques to console Esme? Supporting a patient in their time of need is a delicate process. It requires thought before every action and word. Right from the start, Nurse Jessica showed Esme respect and kindness, asking if she can call her Esme instead of Miss Jones, to slowly grabbing Esme's hand to allow time to accept or deny the consoling gesture. When showing your patients empathy and support, nurses need to ensure the patient is feeling comfortable and safe to open up. Our group believe these touching and comforting supporting techniques are great efficient approaches to caring.